Once again, welcome again to the Youth Talks podcast, where the youth amplifies their voices, but not only that, they also find their solution to their challenges and make way for futuristic and innovative solutions to make the future better and healthier. I am not alone today. My name is Andy Momono, and I will be your host. I will start from my right, introducing Mr. Bonnie. Would you want to please share what you do and introduce yourself to our followers today?
Thank you so much, Andy. My name is Bonnie Mukombozi. I work for VSO. VSO is an international organization that intervenes in Rwanda and other countries, mainly around health, education, with key core approaches of inclusion, social accountability, and resilience. So in Rwanda, I lead the other program, including Make-Good Project.
Welcome to the podcast, Bonnie. Here we are with Martina. Want to tell us a little bit more about what you do?
Thank you, Andy. My name is Martina Abera. I'm a journalist, TV presenter, producer at Rwanda Broadcasting Agency. But I'm very passionate about youth empowerment, but specifically the advocacy for women and being the voice for the voiceless for young girls and women, and making sure that we can be able to amplify their voices and speak for those who are not being able to be heard.
Amazing. It's a multi-talent. Yeah. Welcome again to the podcast. We are with Mbabazi Fiet. Please introduce yourself, and we look forward to hearing from you.
Thank you, Andy. I'm Mbabazi Fiet, Partnership and Programs Coordinator at Learn, Work, Develop. And I'm also a youth champion in VSO in the Make-Good Project. I'm happy to be with you here.
Welcome to the podcast.
Thank you.
Yes, please. We are with Dr. Michel-Ange.
Thank you very much. Thank you very much, Andy. I'm Dr. Michel-Ange Kramaje. I work for HDI as a SRHR advisor. We do provide services in sexual and reproductive health. Yeah, thank you.
Amazing. Today we are celebrating International Health Month, and today in this conversation, our motto, our conversation shall lead more to health is power, and the role of the youth in advocating for SRHR. If I come to my right, Mr. Bonnie, what do you think is what's stopping inclusion to be at the stage where we want it to be today? And if it is at that stage, what are we doing to keep it?
Yeah, thank you so much, Andy. One of the issues, one of the challenges that we really feel should be given much attention across partners, different organizations, stakeholders, is looking at a person not living one single issue life, one single issue struggle, because we don't live just one single issue. We live a compoundedness of different aspects. There could be aspects of age, aspects of ability or disability, aspects of gender, aspects of space. All these come together to create a situation where a person can be enabled to access reproductive health and reproductive and sexual reproductive health services or not. So that is the one of the things I would like to start with. The second aspect is that across the different partners, VSO is championing the aspect of intersectionality, looking at a person from a holistic perspective, where we need to be addressing different challenges. There could be challenges around accessibility, availability, quality sexual and reproductive services. There could be issues around the lack of participation and space for the young people to really participate in decision-making processes. There could be challenges around societal and community stereotypes which serve as barriers towards speaking out, but also participating for the vulnerable youth. There could be challenges around policies. There could be challenges around underfunding of health-related initiatives. This is I'm talking about this from perspective where make-way project being implemented in Rwanda, Kenya, Zambia, Ethiopia, and Uganda, where the experience is showing us that really there's continuous chronic underfunding of health-related initiatives and services, which of course limit access to services to SRHR or sexual reproductive health services for the young people, especially the vulnerable groups of people, the young people inclusive, the vulnerable groups. We all know teen mothers come in this group. We have young people with disabilities come in this group. Those from quite rural, poor backgrounds come into this group. So I feel those are the key highlights I can share for now.
It's true. Spaces must be created, much more of them actually, and that to promote the ability to speak up. And today we're not just dealing about physical spaces. Now we have the digital platforms, where people educate, speak up, and also are able to help each other. Martina, you are using your voice powerfully, and you have been in the media, you have been a person many young people really look up to. And how do you find these challenges that Bonnie has just talked about emerging? Do you think social media is helping out, or it's actually making the misinformation even worse?
Yeah, it's a little bit of both, unfortunately. It's a bittersweet feeling. So social media platforms as well as digital spaces or platforms are powerful tools to be able to advocate for sexual reproductive health and rights, because they are able to find people, especially young people, where they are, which is online. Right now, the youth are online, and that is finding them on Instagram, X, Snapchat, TikTok, WhatsApp groups. So that is where they are right now. So through these digital platforms, this is where such spaces are being held right now, which is a good thing because it allows more engagement and it allows for people to be reached across all atmospheres, not only necessarily holding spaces in a conference room and possibly in a summit, but through these platforms, people can be able to spread information or raise awareness about SRHR through a wide spread of channels. So one thing that these platforms do help is create a safe learning space, because right now, like we say, there's a lot of stigma around SRHR, and making sure that people can have access to accurate information that is not misleading is very important. So digital spaces and platforms have created an area where you can be able to reach out. If you want to reach out to someone, you can do that through anonymity. You can be able to text someone through their DMs and seek proper information. Someone can post a video. Let's say, HDMI can be able to post a video spreading awareness or making sure that there is some lights to SRHR, and someone can come to the comments and ask something that they want clarity on, some clarifying information. So that's the power of these digital platforms. You can be able to reach people in a way that they can be able to relate to, especially these days. The attention span is very limited. Yeah. So whereas back in the day, textbooks were provided,
newsletters,
yes, letters, or even just knowledge on websites were provided and you have to read. Today, people just want to have a 30-second video explaining complex terminologies.
Then scroll.
Yes, and scroll. So medical terminologies explained in a way that even a 10-year-old can understand in a 30-second video. So that's how these digital platforms are helping that. But sometimes the information can get lost just because right now we just want to scroll. And if we see it's about sexual reproductive health, someone can feel like they know enough, yet we really don't know enough. So what I would really like to emphasize is that you can never really know enough, especially about anything. So we're constantly learning. And so once we fall on such productive information or information that can be able to help us, especially in terms of breaking the stigma, helping our young girls understand their menstrual cycles, having access to contraceptives. Let's say a company has released a 30-second video explaining how contraceptives work in 30 seconds. That's very important because
Informative, yeah.
exactly, very informative. Young people don't know how it works. They may think they know, but they don't know possibly the side effects of contraceptives, how often you should use it. So it's very important for these digital platforms to access different ways in which they can be able to engage with their audience, especially because they have the upper hand, because they can reach anywhere. To anyone, anywhere, all over the world, all over the country. Now the country has really provided, or continues to provide fiber internet even into rural areas. So we can find different ways in which we can utilize the digital spaces that we have.
Accessibility is easier,
Yes, it's very easier right now. So we just need to make sure that now that we have the attention of the people, what are we using it for? How are we using it? And making sure that the 30 seconds that we have, let's say Andy is scrolling, the 30 seconds that I have of your attention, how am I going to use it?
But you know, is it just me, or do you see sometimes in the post these bots that comes in the comments, and then they are putting weird information about the pills to use,
True.
about what to do if you get. I was hearing a young person saying, a person told them that if they have sex, the buttons on the face are gonna go. You know, like such are also information that comes along the
Through
comments,
social media.
along the social media, because everyone now, it doesn't matter if they are experts or not, the platform
They
they,
have a
use,
voice.
they have a voice. Now, how do we filter that? How do we help each other to filter that, especially to young people?
It's definitely a challenge. First of all, it's proof that you can actually captivate someone's attention through social media, through the comment section, because the comment section is where you can be able to ask questions, seek clarification, but also you can find misleading information. So I would just like to encourage everyone to, first of all, not believe everything that you read, especially if it's not verified information or information that is coming from a verified expert, not necessarily you having a take on your account or anything, but just try and fact check. If you're reading something and it piques your attention or it is intriguing, before you follow it up or before you go ahead and act upon what you just read, just go ahead to another social media platform, get a second opinion on a different app. We are advocating to integrate AI and ChatGPT in our daily lives, as opposed to feeling like it's going to take over. Let's use it as a tool that is going to benefit us. So if you've read something and you keep seeing it somewhere and it's either fishy to you or very interesting, just seek a second or third opinion, and I'm sure it will just change your mindset towards that thing. So let's just make sure that we can be able to fact check some of this information that we're reading or seeing.
Very, very important. And let's come back to physical spaces. You know, it's important that we use digital platform, but also sometimes we meet physically, and that's part of what you're doing in your work. How is it going? Tell me about the story of how a young person just end up in health. You know, there's many things to do, and why did you choose to follow up with health? And also with the work that you're doing, how is it going? What's the stories out there in the fields?
Thank you very much for asking such a good question. Specifically sexual reproductive health and rights. That's where I am. So sexual health remains a fundamental human right, yet for many marginalized young people. And however, it remains compromised by discrimination, violence, lack of access to essential services, and these challenges are pronounced or announced in young people. As a young person, I felt the urge to take the accountability, to be the voices of young people who are having compounded vulnerabilities, as Bonnie mentioned, that some of the young people are having disabilities. You can imagine a young person who has hearing impairment, the physical impairment, to mention but a few. And you can imagine a young mother, a teen mother who is in a remote area, who doesn't know what SRHR is, who doesn't know where services are provided, probably in our community. Different aspects and diverse group of people having issues, and they do not know how they can approach or what to do when they face different issues around sexual reproductive health and rights. So I felt the urge to amplify the voices of young people.
And what triggered it?
When
was that moment when it came to your mind and you said, this is what I'm going to do with my life?
Oh, well, a lot of aspects triggered me to be in this working area, but most, I think what really did that, or what was the lead, was that most of these issues are affecting young people. And we have seen leaders encouraging young people, we are the future. So I was concerned if we are the future and most of the health issues are affecting young people. Last year, it was recorded that 22,000 plus young girls were happened to be teenage mothers or got pregnant while in their teenage age. So you can imagine such a girl, probably most likely she's going to end up dropping out of school. She's going to end up being a burden, not only her, but also the baby she's going to birth. So I looked at that, and I was concerned as a citizen who wants to see a future of young people leading, becoming leaders. And that's pretty much what encouraged me to take a step to stand up for young people, to let them be informed on different rights of sexual reproductive health and rights. Because again, when you look at, as Mama Martina was saying, that there is no appropriate information for young people to make informed decisions. Most of them are told, they have myth going on in their communities. I mean, social media talks, a lot of people access it and they have different aspects. So young people make uninformed decisions, and plus that, when it comes to access of their SRHR services, it becomes an issue because of different compounding vulnerabilities they have. So I felt the urge to take a step to stand up for them and amplify their voices.
And how is it going now? Since the first time you started doing that and with your fellow youth, which is one thing or two or however many that you've seen and say, "Wait, this is progress. This is why I chose to do what I'm doing"?
Well, what I'm happy for right now, or something I can celebrate right now, is that we were able to form safe spaces for these young people with compounded vulnerabilities, where they speak up openly and discuss their issues around health, reproductive, and their rights around the SRHR. So in most cases, we assume that probably they do not have condoms, they do not have different services. Yet they also have different intersecting issues that are affecting them. So without having a safe space for young people, you will not get to know what really affects them. So one of the things I celebrate today, and to the organization I work in, which is Learn, Work, Develop, is that we were able to create a safe space led by young people, peer educators, who have been through the same issues, that again, they are teaching other young people to know how to carry themselves, to know how to access services and different aspects on SRHR. And young people are now open. Young people, we are also helped by the use of different tools in make way, like intersectional community scorecard, where we discover their issues and then advocate for them. Another thing is confidence in young people. When we started working in remote areas, in communities, you would see the fear in young people. But
What kind of fear? To speak out?
To speak out,
Or they feel like what they're speaking about is taboo?
It is a taboo, sensitive, it brings shame to them. It's something that you cannot speak in public. So what I like today is, or I should celebrate, is that young people are now having enough confidence to stand up and hold leaders accountable of different issues going on around SRHR.
Oh,
Yeah.
amazing. And I'm proud of you. Really, those are the initiatives that we need to see more young people doing. And a young person following us today might ask ourselves, okay, so how do you get that? Is it free? Is it on healthcare? Is it, how do we access that? And Michel-Ange, how do we make healthcare really accessible? What are we doing, if we're doing anything yet?
Yeah, thank you very much, Andy. I think one of the among of the challenges the youth face right now, it's youth-friendly health services, where you find that when the teenager or any youth goes to access health services at the youth corner, you may find like someone or a healthcare provider who is supposed to provide those services is not around, maybe due to the shortage of employees or healthcare providers. You have been saying that sometimes there are so many rumors whereby they say if you do the sexual intercourse, you will not have acne, which are rumors. So you understand it's a big challenge. Most of the time the youth is at school, even in the society. There's one time I remember I went to Gwagotenge school to see how clubs, clubs and things like that, they operate and all those kind of things. We did the survey. There was like a pre-test and post-test. So one of the response I've been seeing is that you may find like, yes, the teacher is teaching you about the CAC, but not in appropriate way. Maybe the teacher is just passing some information whereby the youth is willing to know. The youth is having, like the student. Yeah, the student is having the book, but there are some pages maybe they are being skipped, maybe due to the beliefs of teachers, things like that. So that's also one of the causes whereby the youth is not getting enough information.
Do you think belief is getting in the way of us getting to know the right information as a youth?
Yeah. Believing or religion.
Religious belief.
Yeah. Is somehow, it can be the cause of how you can provide information.
So do we need to add pastors then in this conversation?
Yeah, we have to tell people how important SRHR is. SRHR is part of our body. It's our body actually. It's how our mind works with the rest of the body. So I think it's important to have information about that. Yeah.
And that brings me back to Bonnie when we talk about what the government has to do, what the private sector has to do, and also other organizations. And how do organizations work together so that we also don't dispatch efforts when we can actually work together to make sure that these activities are done now in a broader way? Do you think we are working together enough as organization, the private sector, and the government to actually put these SRHR rights?
I wonder why you are choosing difficult questions for me. But I may need time to do research and come up with a strategic approach to that. But I'll speak from my experience and in terms of what we do. Well, first of all, my colleagues have really highlighted key aspects around challenges and how they manifest. I believe we need to really tackle the taboos. The other aspect is really to create synergy Yeah, yes, could be resources and have not been enough sometimes given the demand vis-a-vis supply. But how can we bring together, really create synergy, bring together energy, I mean, brains, knowledge, at the same time, experience that can be shared and can be used and applied to tackle the problem.
Right.
I mean, use less to achieve more. So I think this is something that can be continuously put to discussion, and then probably short-term, long-term, medium, long-term solutions can be
Yeah.
achieved.
And you shared that now VSO is in different countries.
Yeah.
Do you find the effectiveness of VSO being easy or hard depending on countries, or do you think that it's all the same in terms of like how easy it is to actually put the ideas into work, or you feel like some countries are still struggling with the right policies to actually facilitate such stakeholders?
Yeah, to be honest, yeah, I mean, I can talk about Make Aware, the 5 countries, that's Rwanda, Kenya, Uganda, Zambia, and Ethiopia, where Make a project is being implemented, which uses the same approach of the intersection approach, same model of creating partnerships, creating coalitions, and our experience as VSO. I would say the challenges really from a community perspective are more or less the same. We are talking about high rates of teen pregnancy across these developing countries. We are talking about increasing cases of new infections, including STIs, HIV, health risks happening across. We're also witnessing shrinking budget around health across these countries. And that's on one hand. But also on another side, we see that there are challenges really coming. We've just had COVID recently. We are also having different, interventions from different partners. You've seen USAID cutting funding. You've seen different challenges around the funding space around health, which is affecting across this country, this context. But in terms of specificities, you see that the issues are different based on the context. But I would say from Rwanda's perspective, really, Rwanda stands out across these 5 countries in terms of the interventions, in terms of the will to look at issues, have conversations, plan for them, right at the community level, national level, which is really very much good news for the Rwandans. But also, even in terms of change happening, the participation, the voice, and also the way we are being able to really participate in this, using these platforms to create conversations is something that is really good. Of course, there are good stories. I mean, countries can talk about which I may not be in a good position to really share from first hand. But I would say it's a journey, and the more we create such conversations, the more we spark dialogue, we can be able to really find progressive solutions.
And I want to come back a little bit on the young Martina. You know, when she was probably 10 years old, 12, she's getting to 13 and getting into her teenage, and she's starting to get so curious. You know, did you face a challenge of who to ask as a growing girl at that time? Be it in families or class or uncles, did you, or you would say that your surrounding helped you?
Fortunately, I have a close relationship with my mom, so it was easier, especially around that age when some of us are getting their period and you do not know what's happening to your body.
Yeah.
But it's great that I had someone to talk to. However, in school, that topic was still a taboo. why are you mentioning your menstrual cycle? It was still something that we did not understand. It was not talked about enough in school. It was not made safe enough, or even it wasn't made something that can be talked about enough. So in school, you can see someone struggling, and yes, there may be access to menstrual instruments that you can be able to use, but no one is talking about it in a way that it makes you feel like you're a normal human being. And I hope that that's something that is past and we forgot about it, and it's in the ancient times. I really hope schools are doing better right now in terms of making people feel safe, making students feel like they can be able to approach either the nursing station in the school, or even provide spaces or physical outlets where you can be able to access such menstrual instruments, or even understand how they work. Not even a pad, but also a condom. Understand why it's safe or it's important for you to use such instruments, as opposed to going the other route, which can in turn or later on in your life bring about consequences or situations that you were not even prepared to enter. So honestly, I can say that I was fortunate enough to have access to information at home, but outside home, it was really not. Yes, it was not something that was talked about enough,
At least you
or
went
even
out, but you went out informed.
exactly,
Yeah.
or even normalized. Because some of these things, we still feel like we can't talk about a woman's cycle. We can't talk about the importance of using contraceptives or the importance of protection, and we feel like it's something that we need to talk about behind closed doors. Now, if young kids of today grow up understanding that these are conversations that really can be had, or can be had with our elders, then they're going to fear to ask the questions that we have. And we watch or see a lot of things on the internet, things that are misconstrued, things that are, like you talked about, the things that people bring about in the comment section. Now, if I'm not made to feel safe in terms of bringing this up with an elder, a father figure, a mother figure, a guardian, then I'm going to take that information that I just read and apply it, as opposed to reading that and ask someone older than me, like, oh, I just read this. Is this true? Should I do this? Is it appropriate for my age? Should I wait until I'm older? And so such conversations need to be normalized. They weren't back then. There's a lot of progression in terms of that area. Is RHR. We're grateful for that, but a lot more needs to be done, especially in terms of creating these platforms that we can see every now and then, and also not making it less of a monopoly, and also creating various streams that we can be able to collect valuable and actual information that we can be able to use.
Yeah, I remember back then we were in secondary, probably senior 3. So we had 3 classes, A, B, and C, and I was in B. Now, in A, the biology teacher had started the program of sexual reproduction, but we were still going on with probably osmosis, you know, and we knew that our fellows are getting into something very interesting.
Very interesting.
Always interesting. That time of
And
the
the curiosity was high. So one day we had the biology class, and I remember one student has just drawn in big letters sexual reproductive on the blackboard. And so when the teacher came in, it was like, I thought today we're still on osmosis. And everyone was like, no,
that's not what we want to hear.
that's not what we want to hear. Yeah, so, but it goes like that. And you're talking about something really interesting, but now on social media and on digital platform, we're seeing that there's no limit of sexual content. You know, you can still access good, or because of these algorithms, just before you know, your kid will take your mom's phone or dad's phone or an uncle's phone, and before they know, they're exposed to content that is just from 0 to a level where they need it to actually be taken step by step, you know. And so how do we prevent that, Mr. Mikalon?
I think the government should know where to tackle these issues. For example, youth are very much exposed to digital tools, phones, and tablets, all those kind of things. I think if the government can also invest in more creating applications, even online or offline applications, it can help. If the government can create or put more effort in creation of those applications, for example, use WhatsApp. So if they can create an application similar to WhatsApp, or you can access SRHR application, that can be also a good idea. Moreover, than being exposed to external applications or having up to external platforms, because all the platforms don't provide accurate information around SRHR. I like the question you asked our colleague. Now it reminded me something. One day I was sitting with a mother. She's also a public health specialist.
Right.
Now I asked her, how do you teach your kids or even your daughter about SRHR? Now she told me, like, yeah, we sit down, we talk how the menstrual cycle goes and those kind of things. Now, you know, teenagers, they are sexually active. Now I asked her, sometimes do you maybe tell her or advise her to use a condom in case maybe
It happens.
maybe your daughter have a boyfriend or something like that? Now she hesitated. Now I don't know, that comes to how parents must teach or must provide information. Yes, you are telling your kids how the physiological changes your body is having. You are telling your kids about the menstrual cycle, but you are not telling your kids when it comes to sex, because it happens, we are human beings. And the youth, they are more active, sexually active. They also should know how to communicate with their children. Yeah.
It's interesting. You just talked about boyfriends and girlfriends. I was seeing Balazi on form. I probably thought you. He just asked you where you are.
Yeah.
But what do you advise usually in your fellow youth? How do you advise them to actually sometimes have a stand and have a word and say, you know what, I cannot do this? Sometimes, just like you said, the youth is being involved into sexual activity at a young age now, you know, where they've seen it on TV, they've seen it whatever, and they just come and say, you're my girlfriend or you're my boyfriend, we should do this. So what do you advise them when they ask you that? It's like, my boyfriend told me this and I thought it was the right information.
Thank you very much for such a question. I'm not going to complain like Bonico, or it seems to be hard. I think my advice would be, I'm not going to say that they should stop engaging in sexual intercourses, because at the end of the day, those are their rights. That's why on SRHR, sexually reproductive health and rights, they have rights to, they are entitled to that. But again, how...
At the right age, at least.
Yeah, at the right age, and how safe are you when, engaging yourself in sexual intercourse? Are you actually informed that when you do not use condoms, you are likely to conceive, or you're likely to get STDs, sexually transmitted diseases? And the other thing, when I'm giving advice, I highly advise young people to abstain. But if you fail to abstain, please be cautious of your health, of your future. Do you know what exactly the repercussions of what you're engaging into is going to be? And this is why I think we have a lot of teenage mothers. HIV, it's been recorded that young people are contacting it at a high rate compared to the rest of the population. And yes, I would like young people at the back of their minds to have, to know that at the end of the day, when I engage myself in sexual activities, I'm going to end up having probably a baby at a young age. But again, I'm not here to to tell them to stop, because those are their rights, as I mentioned, that at least they should use protective measures when it comes to that. And also, young people should, take a lead to ask their parents to hold them accountable. I know it's not as easy as we might think. I mean, we've all grown up in African households. You know how hard it is to carry on our conversation with your parents around sexual reproductive health and rights. I mean, we know that mothers or parents are also, I think they have stigma. They do not want to talk about these issues, but again, they'll tell you that if a boy touches you, you'll get pregnant.
Yep.
Which I think it's a misleading information, because that gives you curiosity as a young girl to see what really happens. And what we study in school is contrary different from what our mothers or parents tell us. So I would like to challenge young people to face their parents, and also advise parents to be open. I mean, if you do not sit your children down and tell them, they will have access to, they have access to phones and internet. They definitely will get what you are hiding from different sources. So, I mean, lastly, I would advise young people to make informed decisions when it comes to sexual reproductive health and rights.
I can't agree more. Bonnie, we're heading to the wrap-up of this conversation, but you seem like a person's uncle. You know, when we are talking about the taboos, do you really believe that all of it should be dropped, or some taboos have actually helped us in our back years to take it as a taboo and not fall in the traps to actually abuse our rights to sexual reproductive health?
Yeah, I mean, I would say really the most important thing, let's say, let me talk as an uncle, a niece, a nephew, which is true. I do have them. The most important thing as uncles, parents, aunties, and elders in our community, teachers, we need to be really honest and ask ourselves, what messages are we giving to the young people around sexual and reproductive health? What are the messages? How are we giving them these messages? And when are we giving them these messages? I mean proper messages, which is helping them to make informed decisions, but most importantly, be able to really openly discuss these issues, not to talk about them, around closed places, but to openly discuss these issues, to really open conversations between parents and young people and their children, and around sexuality, sexual education, health and the expectations. Talk about the beliefs, the constructed messages around the community.
Yes.
Because the taboos evolve, the taboos of the past years are not the taboos of
No
today.
longer the taboos now. Who
exactly.
educates the parents though?
Yeah, exactly. So I think we are living in a very fast-paced world, and things are changing every day. There are new things, and the young people are gathering a lot of information. So I think it can't be just one thing. We need to be looking at family level. How are the families having space, conversations around with their children, with the parents? We need to look at the community level as well. What's the role of the community? How are the cases of GBV being addressed? How are the cases of stereotypes being constructed? Then we need to be at the structure level. What is the structure? How is the medicine? How are the health systems functioning to respond to the needs of the young people? So I would say that really this is not just one single approach, but look at the community, as I mentioned, but of course, having really practical measures to say, these are the problems we need to be addressing, having the youth participating in such spaces.
And as we're about to get to the end, everyone in their work, everyone in their scope of work, what is that one action It can never be one action, but it can always be centered to really an action that you take today. Michel-Ange, what is it that you would like to suggest or even request, either from the partners, but also that one action to the youth today that's following us and deciding to change their life and make it better?
What can suggest is that the youth to be involved in many things. For example, in policy making, they should be involved, because at the end, it will come to them also. So I've seen so many NGOs also starting using the youth, which is probably the good thing. So it means like things which are being to affect them, if they are integrated or if they are part of the decision making or policies, them themselves, they know what they need, they know challenges they face, they know where the problems are. I think that's a good one of the good strategies to resolve issues among the youth, for them to be integrated or to be part of the system.
Amazing.
Yeah.
And so, coming back to you, Mbabazi, lastly, what is it, one thing or two, that you have added in your life or improved in your life the moment you started actually understanding better these sexual reproductive health rights, that you would like to share with the youth that's following us today, so that they can use that and get the benefits that you had?
Yeah, thank you very much. One of the things that I've gained from the spaces I am in right now is capacity building. They've really built my capacity in terms of different tools, in terms of different aspects. They've built my capacity. And you cannot, as Michel-Ange said, that involving young people without building their capacity. So I appreciate the fact that my capacity, I am informed on different aspects, on different topics, and you know, it's very easy when you're informed to carry on advocacy. So I actually do informed advocacy. I know what I am doing because at the end of the day, my space educates me on different aspects, and I mean, it feeds me with a lot of information, and also the confidence. I mean, I would encourage young people to be confident enough, because at the end of the day, as I said, that SRHR or sexual health is a fundamental health human right, and we all need to be concerned. We all need to be held accountable. Lastly, I would advise, and this has been my advice to every time I get a chance of, you know, of having such a space, is encouraging or advising NGOs or different organizations to meaningfully involve young people. Not only in an event that they get to invite them, which we call tokenism and manipulation of young people, because you think at the end of the day they'll be happy getting a t-shirt or transport money, but we also want young people to be involved right away from the designing of different solutions that are addressing their issues, to the implementation, in fact to the evaluation and monitoring of programs around the issues, mostly on SRHR issues. So when involved, I mean, there's nothing for us without us. It's always against us. So I would highly emphasize organizations to involve us, the young people, so we can amplify voices of young people with compounded vulnerabilities. Thank you.
Amazing. And today, one person or two is watching us from the phone, and after the video, they will scroll, you know, they'll probably research something else. This is a question that even the colleagues here can help you answer. What are like the 4 platforms, if we wanted to really get to build our capacity? What are like the 4 platforms or 4 websites or 4 spaces we can be in as a youth to today be sure to actually now understand and be informed?
What platforms that the youth can be able to use?
Yes.
For SRHR information, maybe Twitter and Instagram in terms of accessing visuals, more for if you want to be captivated, but also the platforms are there, but the companies, the organizations, the NGOs, the government need to utilize those platforms. So they the youth need to be able to access such information on such platforms, because the platforms are nothing without that information. And so recently the United Nations Population Fund, together with Ministry of ICT, signed a memorandum to be able to bring access to sexual reproductive health rights information, so making it more accessible and timely information, making sure that it is accurate. So maybe looking out for such platforms that, or such information that is going to be released following that memorandum, and just making sure that you are actively seeking for that information, because there is one thing for the information to be provided, but as a young person, I would encourage you to actually seek this information, to stay informed, especially the way medicine changes these days. Information is always being renewed and new things are always coming out. So just make sure you are staying up to date with the information that is coming out, and information is power, so just stay informed and I think you'll be good to go.
Right. Well, there is a saying that goes like the family is the smallest form of the government, and it starts from the family. You know, today, what is the best way to take up this conversation in the family? Where should we go from here?
I would say we really need to look at critically the right values that we're instilling, that we are helping young people to grow up with. What are the values? What are the do's and don'ts? And openly have discussions around these issues, really at family level. But also the family, the parents are challenged really to create space to have conversations with young people. But I know we are closing this, and my thinking would be that broadly, coming back to your earlier question, broadly, how do we go from here? One is young people need to really take and better use of the existing spaces. There are spaces, even at the community level. Are they participating in the Mihigo formulation? Can they go and give ideas? Can go to the community, can they participate in community meetings? Can they follow up and engage and say, the Mihigo, the issues that we raise, are they being depicted within these conversations, within performance contracts? That's quite a critical example I can give. The second also is on the side of the supply. There's demand and supply. The supply is around, the message to the duty bearers and the decision makers that we really work with closely is around, we are now talking about this month, the Health Equity Month, promoting around health and access to services, SRHR services. We need to be looking at whether the existing youth corners are really being effective. Do they have the tools? Do they have the materials? Do they have the necessary services? So I think this is a question I'm throwing out there. But going forward, I think it's good that we keep collaboration among the partners. We need to have conversations, both at national level, on such spaces, but also have more at the community level. I wish one of our partners can create one at the community level and even at different stages. I think this is just an example, but which can be leveraged on to move forward. Thank you.
Amazing. Thank you so much, for the conversation. Thank you so much, Martina Vera. Thank you so much, Balazi Fiet. And thank you so much, Michel-Ange. And thank you for having followed us from the beginning until now, if you have. So it means that you have learned quite a number of things, one or two. My name is Andy Umono, and until next time, stay bold, stay healthy, and use your voice to actually create a better change. Also, you can follow us on VSO Rwanda on all platforms, and see you next time.